deal with a lot of residents as far as teaching courses. So I'm involved with ACFS. I'm involved with AO North America. I'm involved with the PI. So some of you may have seen me on those circuits. And so courses like that I still do. And I don't have a program right now. I just took a new position at a VA. So I'm just like, staff member, but I don't have any residents at this point. And then I've, been on the other side of the fence as well, resident myself, of course. And then I did a fellowship too. So I've been on that side of the fence as well. So, it's interesting on both sides of it, but that's basically my background.
So for me, my name is Mudasser Javed. For those of you guys who don't know me, I actually met Dr. Raja when I took the AO North America course. He was teaching me during it. so thank you for that.
Yeah, man, no worries.
So I actually finished my residency 5 years ago. I went to Good Samaritan Hospital Medical Center, which is in Long Island, New York. I finished there in 2019. I joined private practice after that. So I joined Orthopedic Associates of Long Island, composed of 18 orthopedic surgeons, and I was the first podiatrist on staff in that orthopedic group. We have now since hired 2 more podiatrists to join the group, so I think I did kind of decent to open up the door for them. And then 2 years ago, I took over the Good Samaritan Hospital Medical Center residency program. So I took over the residency directorship, and Bruce McLaughlin, who was my residency director, he was kind enough. He wanted to retire, but we kind of kept him on and forced him to stay on. So he stepped down and became the associate director to help me with the transition. So he probably has another year left, and then we got to look for a new associate director.
Okay, great.
Welcome, everybody. Oh, go ahead.
Sorry. Yeah, we'll kind of save, we'll do like questions and things like that at the end. Or actually, what I'll have you do is, if anyone has any questions, feel free to just kind of throw it into the message, the chat thing over there, and then we'll kind of just filter through those as we get going. But Ali, I don't want to keep you from your introduction. If you want to go ahead and introduce yourself, that's fine too.
Sure. Yeah, just quickly. My name is Ali Ahmed. I'm from Houston, Texas. Second year at the UTRGV school, the one that just opened up a couple of years ago. And we're about to start. I'm going to start my second year in a couple weeks, or next week actually. So that's it. That's my introduction. Very short.
No, that's good. That's good. We're looking for representation from all the schools, especially the new ones, as we don't really know. There's not much of a social media presence or anything like that. So it's awesome. Thank you for joining. And like I said, anyone else who has questions, feel free to start typing them into the chat, and we'll just kind of go through those. But I guess to start, I guess we'll start with Dr. Raja, since you introduce yourself first. How should students go about choosing programs for externships? Like what are some of the criteria that they should look for? And Dr. Javed also obviously chime in as well.
Yeah. Well, programs are very heavy in a certain kind of pathology. Some programs are trauma heavy. Some programs are Charcot heavy. Some programs are sports heavy. There's a few programs, I guess, that are pretty well balanced across the board, but for the most part, you'll find a certain niche. And so if you have an interest in a certain niche, then I guess that would be the most logical, obvious way. You want to look for something that you're interested in. You want to focus on that. Sometimes it's based on proximity. Sometimes it's just like it's easier. You have a family, you have kids. If you have family nearby, it's very cost effective to have, family take care of your kids while you're working, because it's busy hours, you're on call. Sometimes it's proximity, and sometimes it's just based on your relationships. Maybe your spouse wants to be in a certain area, and you have to go with that. So it just depends on, I guess, the short answer is it depends on whatever is the heavier favorite when it comes to your interest or your personal life, or other influences in your personal life that dictate where you need to be.
Yeah, I agree with all that stuff. I think that, um, my one regret when I was doing externships is kind of staying to one location. I wish that I had not saying that I don't like the residency program that I went to or anything, but because I stayed in one location, I don't really know what else was out there, you know. So if the family restrictions aren't there, and the location restriction isn't there, um, I would recommend for people to, even if you want to do residency in one area, but at least try to do externships around the country. You'll be surprised at how different things are done in different parts of the country, and you can always bring those things back to where you're going to be practicing and stuff like that. But like Dr. Raja said, just going to be, are you interested in surgery? Are you interested more in clinical rotations? Are you interested more in wound care? And as you're when you guys are students, it's really hard to know what program entail. So you kind of just pick randomly word of mouth from your upper third and fourth years, um, and you see what you like and you see what you don't like.
No, that's good advice. Like you said, it is hard to tell like what programs are, what they're even doing. I mean, I don't know of any good way of really figuring that out. I don't know if you all have any further advice other than listen to what your upper levels have to say. But even then, I mean, some people have vastly different experiences at different programs based off of the personality types and things like that too. So it is very difficult. It's a tough spot.
I think one of the differences nowadays is that social media has a big presence, as opposed to when I was in your position of applying for residencies. So, when you go to ACFS, you have this like fellowship breakfast hall where like all the fellowships are there, and you have a lot more visibility on the programs that are out there through ACFS and through other organizations. So sometimes, programs will have journal clubs, they'll have monthly events, they'll have, and I'm sure you're welcome to join them. I don't think they have a limitation to it. So you can get exposure to those things even as a first year or second year, just based on hearing about a program, inquiring about, hey, do you guys have journal clubs? Do you have online? I mean, I give a lot, not a lot, but I give a certain amount of talks through Zoom to schools and to programs for their journal clubs. So it's a trend, obviously, since COVID. So that's one way to get exposure, I guess, to figure out what you may like or not like about a program. Just a little more presence there, And the other thing I'm curious too is that back in the day when I was doing this, a lot of the travel that went into visiting a program was out of my own pocket. It wasn't like the school paid for it. So that's another limitation too. Sometimes you want to go someplace and check out a program, but man, it's like the travel, the hotel, all that is just it's expensive.
Yeah, no, that's true. That is true. And I think if anything, the fact that those programs have, journal clubs or webinars or whatever, just shows that they're invested in the education of, young doctors. So that is really important too. Not just the content of the program, but more so that they are invested in that and might have more of a robust curriculum. That might be a sign that is the case. We had someone raise their hand. Was there a Tuba? Azim, did you have a question?
Yes.
Feel free to introduce yourself and ask your question.
Assalamualaikum, everyone. So my name is Tuba. I'm a third-year student at NYCPM. And so we've been like looking, well, our deans have been like coming at us, like telling us to like look at externships because we're going to be soon in the process of applying. So I just wanted to, like, I know Dr. Raja mentioned that each program has its own like niche. So I was just curious, like, how do you find out like what that program has? Because sometimes like what I've noticed so far is like programs usually say that they're like they have like everything. So how do you really find out, I guess, like what a specific, like if they're heavy on wound care, if they're heavy on like like different aspects of podiatry. So how would you like figure that out or find that out?
I guess it helps if you know someone there, first of all, someone that you may have known a year ahead of you or whatever, who ends up going there or maybe is there. Sometimes it helps to speak to the residents who are actually in the program, get a feel for what they think, because it'll be a little more upfront with you. There's always the brochure, there's always like the brochure of the program that we do everything, but there's the actual fine print. So, like I said, with all the ways of being able to communicate with people nowadays, it just comes down to some legwork on your part, but you can get a feel after a while about what a program may be good at, maybe into. Also, like a forum like this is great. I mean, this is a forum that is the first time for me, obviously, in this way. But if you guys had questions about programs, if we did this again sometime, maybe those of us that know people who know people can find out more information. Then we meet again in a couple months, and we can kind of update you on what we found out, stuff like that.
Thank you.
Yeah.
I think the biggest thing is word of mouth. I'm sure you know some fourth years that are rotating right now,
Yeah.
and you can ask them how those programs were. And again,
Exactly.
their experience, like Ali said, their experience is going to be different than your experience because of personalities, because of what they're looking for in a program, because of how many times they got to scrub in. Their experiences are going to be different. You can only tell so much from a month in a program. Let's say that program had the low amount of cases for that month, and then the next month they had a booming amount of cases. So two students even will have different experiences at a program. So just ask around as much as you can. That's my main piece of advice.
Okay, thank you.
I will say also on that note, just in my experience in going through rotations, like obviously when you're picking a program, yeah, word of mouth is going to be the best bet for you in terms of actually picking it. But then once you get there, you'll kind of have an idea of like, okay, this program is like this, and you can kind of develop these little categories of programs based off of academic rigor or surgical volume or wound care or whatever it is. And so you can kind of gauge, okay, this program is probably similar to that program over there. And so you kind of develop that kind of Rolodex mentally as well as you get through your rotations. Kind of along that note too, to our panelists, do you all have, do you think it's essential for students to rotate at a program in order to become a resident there?
My personal feeling is, yeah, I think it's important, because at the end of the day, on our end of it, or on the selection end of it, you're looking for people that I mean, it's not just about academics and someone being academically strong. It's about someone that you have to live with for 3 years, and you have to be able to get along with them. You have to have a personality that, that indicates to you that they're likable. The staff will get along with them. It's, a lot of times when we used to look at a candidate, it wasn't just me making a decision. It was like the resident input and the nursing staff input and the OR staff input. Everyone got to know the people. So yeah, I think it's important. I mean, I think it is. Have people been selected before that we just met at the interviews? Yeah, that's true as well. I remember one year I selected a resident just based on the interview only. But by and large, I'd say it's mostly knowing people.
Yeah, I agree with Dr. Raja. I don't think it's mandatory, but what I will say is, out of the 9 residents that we have right now, 3 per year, 1 didn't rotate with us.
Mm-hmm.
So 8 out of 9 have rotated with us. We got to know them, and I think a big part of that is, and again, this is again my experience and Dr. Raja's experience, but there are many programs out there that will take residents or students that didn't rotate because they don't care. They care about GPA. They care about if they were in the top 10th percentile. But at our program at Good Samaritan, I really look at how that student fits in with the other residents, because culture is very important to me, and I think it's important to the other residents. And again, I don't know how you guys did it at the military, Dr. Raja, but it seems like you guys did it in a pretty similar way.
Yeah, it's similar. I mean, there was the added component of the military having to accept you as well. There was some criteria you had to meet to be in a military program, but that's completely separate. At the end of the day, you know, that's what it came down to. Because, you know, a good GPA isn't always reflective of someone's work ethic. You know, people burn out. People become, you know, seniors their first year because they're just tired of being on call, or they're tired of going in. You know, it just happens. So you got to find. It's hard, guys. I mean, you know, it's for you. It's hard to match with the program, and for us, sometimes it's difficult to select someone that we think has sustainability. But yeah, so like the GPAs aren't always reflective of someone's dedication, work ethic, honesty, integrity, all these things that matter when other things, you know, come about.
It's interesting that you said, Dr. Raja. I actually had an experience where I was rotating on a program that I actually liked quite a bit. And then I heard that from the class before them, they picked someone who they hadn't met, didn't rotate there. I don't even think they interviewed. It was that they were scrambling, and then they ended up picking the person who had the highest GPA. And I was like, that's kind of a red flag for me personally. If you're going based strictly off their GPA, I don't know that I want to be part of that culture. And that was a tough decision, but you know, that's something that I stand by.
Yeah.
It looks like W Patel 718. I understand the question now. I misread it. They said they're interested in hearing what program directors look for in a candidate. And Dr. Raja, you did touch on that a little bit. I guess you both did. Maybe you can elaborate a little bit more.
Yeah. My criteria at the time was, you know, I think my GPA standard was like 3.0. I didn't look for something that was, you know, nothing too crazy high and nothing horribly low. I thought 3 was reasonable. And then just basically someone who we got a chance to meet. You ask them questions that are academic, but you ask them questions that are non-academic. You get a feel for what they're about. You get a feel for where they've been, maybe a life experience, stuff like that. But just get a feel for the fact that they're reasonable individuals. They tend to want to work. Now, honestly, we also looked at sometimes I knew somebody who knew that person. They had rotated through a program. I knew that director, or they knew a previous student that we used to have. You know, like there's always connection somewhere. You always ask them, like, where'd you go? And they tell you where you went. And then you're like, oh, yeah. And in the back of your mind, you know, oh, yeah, I know that program. I'll maybe call and ask them what they thought of this guy or gal. So there's always like a background thing we're doing as well. It's not sneaky, guys. Honestly, it's just part of the process.
You guys will realize podiatry world is very small.
It's small. Yeah, you're right, man. Everyone knows, you know, people who know people. And so that's somehow, then we looked into those things. So, you know, we took people at face value. I'm not saying we didn't do that. But then if we really like someone, we thought that they were a good fit and they were very active and in our program and rotated, then we did ask. And then, of course, when they spend time with us, you know, a month, you learn a lot about someone in a month. You know, you can about who they are and what they're about. And then, you know, near the end of the time I was a director, we also sometimes like looked at their social media world. You know, sometimes it's weird what people posted on their accounts. And so it said a lot about someone. Like I remember the one person when I was actually, it was on the other side, I was a fellow and worked for the next year's fellow. And God, some of these people, man, it's like there's a huge disconnect between who they were on their paper and who they were on the social media platform. And so that didn't play well for them. So just be careful what you post about yourself. You know, that's another thing we look at as well. But yeah, just genuinely honesty, integrity, just someone that we thought was down to earth, could admit when they were wrong, willing to learn. You know, like they weren't a post like, well, that's not the way we did it. And that's not the way I learned it. And I don't want to know this. Like you have to have someone who's humble enough to, you know, pick up on, maybe they know it better than you do. They do. Maybe they're more experienced in that way, but still they don't come off that way. You know, they don't show a sign of arrogance or not temperamental, not flying off the handle. You got to be responsible for your actions. You got to be responsible for not getting upset. So these basic human things you can't teach someone. That's just the way they are. So personality, things like that, not bringing up conflicts, not getting into it, people, not disrespecting, you know, our nursing staff, not acting like you're a doctor and they're just like the subservient, you know, stuff like that. So.
Yeah, it's kind of a fine balance, right, between
Yeah.
trying to show, like, be proactive and show that you're interested. We also don't want to come off as, cocky or,
Yeah.
almost like fake in a sense. Zane was asking if there's any unique characteristics or actions that stood out to you. I mean, I think we kind of talked about that. How much weight do you put into the feedback that you get from like staff or potentially even patients?
A, a good amount. I mean, if a staff member is someone I personally respect as well, sometimes staff members, how it is. It's like a family, right? Some people, you put a lot of weight into what they say, and some people like, okay, I get it, because you hate everybody. There's no one you like. But that plays into it as well. That of course that's a big part of it. How the residents feel, because they're the ones that'll be working with you. You have to be able to make sure that they work well together. And so, yeah, I mean, I think the director ultimately makes a decision when it's difficult to know, but ultimately I think it comes down to, I used to just let, my residents and my other staff members and my trusted people make a decision. I didn't really jump in too much, but once in a while, if I really felt strongly about somebody, I would. But a lot of times we're all on the same page. It wasn't like there was a lot of differences. Everyone kind of felt the same way about people, and it just kind of came to be that way. And sometimes, sometimes we got it right, and sometimes we didn't. But for the most part, it worked out that way. It was just that's why I'm saying getting to know somebody in externships and knowing them and seeing them day to day, and seeing if they, it's a little different nowadays. Nowadays there's this term work-life balance, which comes up quite a bit. As you've all figured out by now, I'm probably a lot older than all of you are. So I have a generation where there was no work-life balance. Like in those days, I mean, you could say whatever you wanted to people. You could abuse them. You could yell at them. Those days are over with. But along those lines, if someone is in an externship and they stick around for cases, they don't necessarily go home because they can go home and it's time to leave. They tend to be genuinely there, and they're interested, and they're showing the fact they're not willing to, willing to stay and do stuff. And that also reflects upon what they are like and what they're all about. So these subtle things that you pick up on,
Dr. Javed, do you have anything to add there?
Not really. Dr. Raja kind of pointed out the main things. I take a lot of account of what the residents say. I take their opinion heavily, because honestly, they're spending so much more time with the externs than I am. I'll spend time with the externs during academics and during cases here and there, but I'm not the only one doing cases. There's residents are doing cases with 15 other attendings. So I rely heavily on them to figure out what they, the pros and cons of each student. And for the last 2 years that I've been picking, the rankings, I have the residents make a ranking list, and I compare it to my ranking list. And that's kind of how I go about in making my picks. And all in all, it's been pretty similar, maybe a couple numbers off here and there, but everybody has a similar feeling about what we're looking for in a resident.
Yeah. One other unique aspect of some programs is that you have some people who are, there's a residency there, and there's also a fellowship there too. Like there's two things running side by side. But point being, that program director or someone in that program may be fairly well published. So if you go to a program and you're really interested in that program, it's good to maybe look up that author, look up some of their articles they've published on, knowing what they published on, because you go to a program and you don't recognize someone in that program is well published, and they ask you about a paper they may have written or something that they may have written on, and you're just completely like not clued in on that. That doesn't reflect well on how much homework you did on the background of that program, especially if you're saying you want to be there, if you're making it known. So that's another thing to keep in mind. Some programs and some program directors are they're fairly well published, and you want to kind of know what they published on and have an idea about the papers they've written.
We have a question from Syra. She's asking if you recommend rotating at your top choice program closer to interviews, or when in the timeline is the best time to rotate at a program that you like?
Ooh, good question, Sarah. Good question. Yeah, I don't know. I don't know if it makes a difference. I would say it may seem maybe more like, yeah, if you rotate around the time of interviews, they know you've left a good impression, hopefully, and then they're interviewing you, so you're right there, and it's sort of like fresh in their mind. But honestly, I remember people rotating not that close to interviews, but they left a really strong impression with me, and they stayed in touch with us. They always email, hey, Dr. Raja, so and so, blah blah blah. So when I met them at the interviews, it wasn't like, oh yeah, you. I barely remember you. I remember them. I remember them like they were there. So yeah, it's not like the interviews are too far spread out. Like someone externed like 3 years ago. No, it's not that far. So honestly, I don't know if it does. I personally don't really have an answer for that either way. I think either way is fine. As long as you do a good job, you're there, you get to know people, they get to know you, you remain memorable to them, and you did a good job with it. I think you'll be fine whether it was 3 months separated or it was the same month as your rotation. So
I don't think it really matters, honestly. What I would say is maybe don't make your top choice the first program you rotate at, just because you're getting used to rotations and you're getting used to externships, and you may not be as well versed in the academia portion of it. You may get asked a lot of questions that month, but again, those programs, if they were fair, they would realize, hey, it's this person's first month, and they would take that into account versus somebody that was there in November or December and had already 3 externships. So I don't think it really matters, honestly.
Yeah. On that topic of questions being another stressor is you're in a program, you ask questions, sometimes you don't know the answer to a question, right? I don't think it's important that you don't know something, like you don't know something, unless you don't know it. You could say you don't know it, but the key is to follow up with that question the next day by looking it up that evening or that night, knowing what's going on with it, and the next day actually answering the question by saying you looked it up and what you did. It's just that when you ask the question, you don't know the answer to it. And then the next day they ask you the same question again and you still don't know the answer to it and you haven't really bothered looking into it. That doesn't reflect well. No one really cares about the fact you don't know the answer. It's more about the fact that, did you follow up? Did you actually learn something? Did you take the initiative to find it? Now, granted, if you're like, don't know any answers, that's a different story. That wouldn't bode too well. But, not knowing something is not really the big deal. It's just the follow through. And I remember I was visiting a good friend of mine, Dr. Suhail Masada in Cincinnati. And there was an extern there and he asked him about, I don't know, so like flat foot classification or something. And the guy didn't know, like the deal. So Hale spent like a good half hour explaining what he knew and then expected the guy to look it up. Next day, he asked him the exact same question. And the guy still didn't know. And he didn't really seem to really care, but he didn't know. And so, yeah, obviously that didn't reflect well for him. And so that's who you don't want to be. You know what I mean?
No, and I think that's a really, really important point. It seems like obvious, but when you're in that mode as a student and you're in the externship program and just externship mode, I guess it's easy to let things slip, but it's important to make those things a priority, because that is a direct correlation to your initiative, your ambition, and how willing you are to admit when you're wrong and follow up with that. So I would say, in my experience too, being resident and a fellow as well, like that's one thing we definitely like place a lot of importance on, is people following up afterwards.
Mm-hmm.
And then I just wanted to go back to the timeline thing as well real quick. I would say, in my experience, like being definitely, you don't want to be, I don't know, I didn't do too well in my first rotation. It's funny you mentioned Cincinnati, because it actually was Dr. Posada's program that I put as my first one. And it did not do well for me. So, and I knew that there was things, like looking back in hindsight after a couple of months, I was like, ooh, I probably should have done this differently. And, he runs a really tight ship there too. So it didn't bode well in my favor. But I would say that after a couple of months, I definitely felt like I was in that flow state. I felt really good about, myself as an intern and my knowledge base. So if in my experience, I would say like my fourth or fifth rotation was when I was like in my prime in terms of, just being an extern. So maybe if that's the way you do things too, if you need a little bit to warm up, then maybe that's what you do. Another question. This one's specific for Dr. Javed's program. I think I'll probably have, if you guys are okay with it, to give out your emails, or we can relay information. That might be more just very specific question about your program. So someone else is asking about volunteering opportunities. Good extern from great extern. We kind of touched on that a little bit. Can you guys talk to us about preparing for surgeries for the next day? Like what do you expect students to know or to just be prepared with as they come to your OR?
If you're a first-year student, the main thing I'm looking for is your knowledge of the pertinent anatomy. That's really what I'm looking for. I don't expect you to be able to do the case or know details about it, but just the anatomy. I think that's the number one thing, even in orthopedics. It's always this anatomy sort of heavy focus. And then lastly, just knowing what the procedure is, like to have a general idea about what is being done. A lateral ankle stabilization, ankle arthroscopy, a lapidus. Like, what are we doing? What are the indications for it? And the general anatomy. That would be for the first year. Second year is probably the same thing, in a sense. And then third years, you get a little more into like selection. Like, you may ask more in-depth questions about risks or post-op protocols, or what would you do, and what if you had a complication, stuff like that. So, but for first years, honestly, or just newer students coming in, anatomy. I think anatomy is probably the biggest thing. Because it's easy. It's an easy thing to ask, and it's something that you expect people to know.
Lee, you're asking about students. How would they prepare for the OR? Is that your question?
Yeah.
Prepare like you're a resident. Prepare like you're going to do the case. All right. Because realistically, it's the same thing that Dr. Raja's saying, is learn the anatomy, but you're going to read about the case anyway. And, the anatomy in that area is probably the most important part. You don't need to know all the details, like, how to make the cut, things like that, where you're getting the wedge from, or, that all that stuff's probably a lot more detailed. But prepare like you're a resident that's going to do the case, because realistically, any question that gets thrown at you, you're probably going to know the answer at that point.
Yeah, that's good advice. In terms of reading x-rays, let's say you're getting pimped on x-rays the day before, what do you kind of look for students? Is that they have like maybe like an algorithm, or what do you look for with that?
Yeah, algorithms can help. I mean, like at the AO course that Dr. V was talking about, when we ask people to read the x-rays in that small group session, usually you'll see people kind of go through a sequence, kind of like a golf shot, you go through the same sequence again. But yeah, that helps. I mean, if it helps you, it helps you. I don't know if I necessarily had one back in the day, and even now I'll look for certain things in the sequence. But yeah, I think when it comes to x-rays, just so you I guess don't miss anything, it's good to have one. But sometimes you're able to pick up on something pretty much right away, and sometimes you spend that time going through an algorithm while you're searching for what they may be looking for. So it buys you time to get there. So yeah, I mean, that's a good approach. I don't think it's a bad idea.
I would say look at as many normal x-rays as possible and read them, because you won't really know what the abnormal is unless you're looking at the normal. So, any x-ray as a student is worth it to look at and just take a quick read. And that's what I try telling all my first year residents is, don't go based off the radiologist read. Just read it yourself. The MRI, the x-ray, read it yourself, read it quick. And And if it's normal, it's normal. But then when that abnormality comes in, it's a lot easier to spot.
Yeah, no, that's great. That is good. I mean, that's one thing that had been drilled in us in school too. In our radiology capstone was like, just look at, and that's how we'd get tripped up too, is they'll just put up a picture of a normal X-ray and say, read it. And you're just like expecting to have some sort of pathology. And you're like, wait a minute, I'm not seeing it. What's going on? And that's when all the adrenaline rushes in. So that's great advice too, is just look at any sort of X-ray. And most schools have, like some sort of a radiology curriculum, right, where they'll have like a set of X-rays in like a Google Doc or something that you should have access to, where you can just kind of go through and practice those yourselves. So you all mentioned anatomy is probably the biggest thing for students to be very familiar with. At least as a residency director, that's one thing that's an easy kind of like low-lying, low hanging fruit for you all to pick, right? But when it comes to students, are there any like other specific areas that might differentiate or make a student stand out when it comes to their knowledge base? Like, are you guys truly impressed when they know things beyond what they should know at this point, or is it kind of like, oh, okay?
For me, just a quick thing that stands out is the way students ask questions. If in terms of knowledge base, I don't expect you to know every answer. And saying I don't know, or like Dr. Raja said, I'll get back to you on that, is not a bad answer. But when I'm doing a case and I'm doing an Evans, and you ask me about the PT tendon in that area, it's not a good look. All right. So just think about the question you're going to ask before you ask it. And students ask some really good questions, and I can tell this person is actually thinking beyond the normal limits of what a student should be thinking of at this point. And they have a process of thinking, that they have a criteria and knowing what's going on in the surgery and what's going on with this certain case. So there are, I know they say there are no dumb questions. There are some dumb questions.
That's funny.
Yeah. Yeah, I've had much more to add to that. It's a pretty good point that you make. Just being honest. Don't try to make stuff up. If you don't know, you don't know. And if you're curious about something, you can ask, and just follow up with whatever you're asked that you weren't sure of, and just be engaged, be involved. Just don't be kind of disinterested or like you don't want to be there. Obviously, I know that's not something you would show up immediately, but sometimes it does come through. But people can, I don't, if people know things that are literature based, that was nice to see. And if you bring it up and talk about it, or even look it up and to want to discuss it, those are all things that show that you're like looking into it and you're researching it. You don't need to know, everything off the top of your head. Even as, even we as directors sometimes don't even know a sure answer for something. Some things aren't, they're more opinion, they're more just, experiences. There's no real, solid answer for it. But I think it's just the genuine honesty behind someone's intent and their work ethic is really what stands out when it comes to that sort of thing. So, yeah.
I think there's also something to be said about, like what Dr. Javed was saying about the time, like how you ask the questions and when you ask the questions it's very important. I mean, sometimes you can be in the middle of kind of a tenuous part of your surgery. It's not the time to be asking questions. When you're a student, you really should be kind of a fly on the wall, watching the director, watching the residents, and their level of engagement. And then if there's ever any downtime, there's like closing is a good time. For example, usually when someone's closing, like if they're suturing skin or whatever, that might be a time to chime in with a question or something like that. So that's also very important. Syra, do you mind hopping on and actually asking your question? I don't know. Maybe it's my dyslexia.
Sure. Assalamu alaikum, guys. I had a quick question. Dr. Javed, you mentioned something about you present cases to your externs. Prior to the cases presented, like what are you looking for in your extern, like the students, like that would make them stand out, like not be like overbearing and like trying to be like that, you know, I know everything, I'm gonna say everything all at once, but like to actually like prepare, like how would you recommend the student to prepare prior to the cases presented and to have that like mindset of like, okay, I'm actually like taking care of this patient? Because I'm in my 3rd year now and that's what we're doing in capstones and I'm having a little bit of difficulty with that. So if you could just give me some tips on how you would recommend me putting my mind and like taking care of that patient, if that makes sense. I don't even
You
know
mean,
if I'm even saying
you,
my question correct.
do you mean like surgical, or do you mean like just like office patients, or?
I would say both, as in like let's just say like a patient comes in for like a neuroma, but like you're working them up. Is that how you're presenting it to your patients or your students? As in like here's the case and then A to Z, what would you guys do?
So, I mean, so for me, some of the students rotate at my office. So it's kind of hard to prepare beforehand for the patients because it's basically things that come into your guys' clinic that you rotate through right now. So let's say a neuroma does come in. I'm curious as to what the student would do, what the extern would do. So, you know, I'll ask them, you know, what would you do in this situation? And then we'll go in, see the patient together. Um, I don't put too much of a burden on if they give me, you know, a wrong answer or something that I would do differently. But I just want to see their thought process. You know, that's mainly why I ask those questions when patients come in, because I like seeing. I'm sorry, guys. That's my daughter just screaming. I like seeing your guys' thought process and seeing why you came to that answer. And why you came to that conclusion. And if it's, oh, I saw this at one of my attendings used to do this at my school program. All right, cool. That, you know, it may differ from what I'm doing, but it's really hard to prepare for stuff like that just because it's just random patients coming into the clinic. Sometimes I'm not even prepared for what comes in.
Sarah, are you talking about like seeing a patient and then presenting to a staff provider about that patient? Or are you talking about something different?
I'm talking about like cases. Because like we're in surgery capstone now and we get presented with cases of like, okay, this patient came in with this. What would you do from A to Z? As in like the workup wise, like workup, what's to the extent, like how would you recommend us as like externs, like if you guys were to ask us about like a case or a patient that you guys did see, of like how to maneuver through that technique of knowing what to do and when to do it and what's appropriate.
So you're talking like you're in a lecture type situation, like or a round situation, and you're just given like, okay, this person comes in with this, that you're talking about, that kind of thing?
Sure. Yes.
Okay. I thought you was a little bit different. As a student, I think you just, you know, just stick with the basics, you know, stick with the basics of the NL-DOCAT, you know, just you would ask about the history of the situation, where the problem was, location, all that kind of stuff. You know, that all is actually pretty, it's funny, you know, the basics are always the basics and they're always important. And even now I find myself going back to the origin story of like how something started and where the problem is. So I would say you get your history to some extent, and then you would talk about your physical exam, like actually touching the patient and what you would do as far as examining. If you happen to have some, you know, maneuvers, you know, like anterior drawer or whatever it is, that's great. You can put that out there. But good history, talk about how you do your physical, and then you come up with your differentials and you go from there. I mean, it's nothing, you know, too rocket sciencey. Sometimes you just have to figure things out based on your exam. So
that's a better answer than mine, because I was thinking you were talking about something different, Sarah. But
yeah, that's why I asked her like what she was talking about, because I wasn't sure myself.
and you're gonna get these case workups on probably every interview that you do. Okay. But like Dr. Raja said, it's the same thing over and over again. Nature, look, duration, onset. All right, ask those things. Vital signs. Okay, get those. Okay, get the past medical history, past surgical history. It's the same thing, no matter if it's an open fracture or if it's an ingrown nail.
Yeah. Yeah, don't start with the labs and the x-rays. Start with the NLDOCAT, then go on to your, imaging studies and labs and all that. It just shows the progression of how you do it, how we still do it, how I did it today, just about 3 hours ago,
One thing, if I may add, so this is one thing that I've kind of seen mostly as a resident and as a fellow, is that when there's students there, especially when you're in your second year, you're starting to learn all these eponyms and names of surgeries, and there's a whole bunch of different types of procedures. And is it the DMMO or the CWO? Like, there's so many different acronyms. It gets really confusing. It gets really easy to get caught up in the wound and the what am I looking for? In the weeds of things, in the weeds of all these acronyms. So whenever I'm presented with like an x-ray, for example, and you see that there's an obvious deformity, the way that I like to look at it is like, okay, so like what actually needs to be done? Not using any crazy acronyms or names of procedures, just like look at the foot and what needs to be done. And Charcot, for example, is a great way to practice that, because there's an obvious deformity there, right? And so as long as you know what a normal foot looks like, you should be able to figure out, okay, the medial column needs to go here. The midfoot is collapsed. Like, just break things down into easy terms. And a lot of times attendings actually like that, because they don't necessarily really care, unless you go down to Atlanta, about specific names, about procedures and whatnot. People just want to know that what needs to happen. So if you see a collapse in the midfoot, just say, okay, well, there's a midfoot collapse. We should figure out a way to lift it back up. What's a way to do that? And then you kind of start thinking about it like that. So I always start with the most simple terms. And then, if you know the names, just add the bells and whistles as they come. And I found that to be helpful for myself. And I feel like, in the future, I'm going to be using that to kind of help students kind of change their paradigm of presentations a bit.
Yeah, that's an excellent point. That's the way I teach too, and that's the way I actually lecture. My lectures are always broken down to very basic concepts and simple terms, and then you build from there. I just think it's an easier reference point than starting someplace complex and trying to go from there. It's just and I think when someone explains it that way, it shows to me that the person explaining it to you actually understands what they're talking about. When you can break something down to simplest terms, that means that you yourself understand it, and now you're teaching to somebody else in a way that's going to be easy for them to understand, and without getting too technical with it. It's a good point.
Thanks. We have a hand from the legend, Dr. Muhammad Junaid Khan.
Assalamualaikum, guys.
Driving as always.
Sorry, I'm driving. Dr. Raja, thanks so much for taking the time to do this. I had a question, actually. This is inshallah going to benefit both the students and for me. Reason being is, inshallah, next summer we're going to start a clinical rotation site for the Lee-Com Podiatry School over where I work in Western New York, inshallah. So I'm going to be tasked with preparing some of these students for getting ready for externship and being good residents, right? So I remember when I was a chief resident, 2021, students were just coming back from COVID. So these guys didn't know how to drape or gown or do anything, because they did all these things on like Zoom, you know what I mean? So, that was like a generation of students who are now residents that, couldn't scrub, couldn't suture, couldn't do a lot of things well. I think Dr. Malay actually wrote a editorial in ACFAS about it. But my question to you guys, and for the students too, is what do you think are the biggest weaknesses that you're noticing with this generation of students? Like, so I can know, so maybe I can work on that with them for these students. Like, what do you think are like the glaring weaknesses? Like, maybe I didn't see this 5 years ago, but now I'm noticing a pattern.
That's a heavy question, man. It really is.
It's going to benefit all of us, inshallah.
No, you're right. You're right.
So I'll start with that.
Yeah, you start with that one.
More so, not so much a weakness. I think, like Dr. Raja said, there's a little bit of a generational gap in what's expected. Okay, so you know, when even when I was a resident, which wasn't that long ago, it was, you basically just do what you're asked from your attendings. Obviously to a certain extent, but you don't really question when an attending asks you to, hey, go see this patient for me, or can you do this for me? Can you write this note for you kind of just do what's asked of you, because at this point you're learning, you're a resident, and I would just do it, no questions asked, and just keep going. It's part of the learning process. As much as it sucks having all that burden on you, it's still just 3 years of your education. I'll give you an example of where the difference comes in now is, my residents were asked to go see a patient by an attending at a different hospital that they rotate at, they do surgeries at. They go there just to do surgeries. They see inpatients during the day, but they don't take night call there. And they were asked to see the patient during the evening time, and they answered back to the attending, we only see patients till 5 p.m. at that hospital. That literally blew my mind, because yes, that is a rule, but at the end of the day, that attending can just say, hey, okay, cool, I let you do 90% of my cases, you can do 0% now. So I don't think students or residents in this day really, I don't know if they don't know the ramifications or if they just don't care about the ramifications, about what is expected of them, versus what they're supposed to do. I can go on and on about this, but you guys kind of get the point.
Yeah, there's been a paradigm shift in the rules that govern residencies, and you guys are aware of this. There are things that are in place from the CPME, ACGME, and the MD world and DO world that has changed the way residencies run. The idea is to have rules in place that protect the residents, that don't allow them to, because like life is always an imbalance of a pendulum. Like it's always on the far end of one side where residents being abused or working crazy hours or falling asleep while they're driving home. And then the rules are put in place to make that go away. But then it goes way to the other end where now residents are just like, leave. I'm sorry, it's 4:30. Sorry, it's over my hours. I'm gonna go home. So, I would say,
I mean, Dr. Raja, if you said that to one of your attendings back in your day, what happens?
oh my God. I mean, you're right, man. It's such a contrast. It's like two different worlds. It's like two different parallel worlds. It's like a different planet we were on before. But I mean, my advice would be this: listen, the rules are there for a reason, and I'm not arguing that they're wrong. They weren't there, maybe for someone like me back in the day, but they're there now. So fine, you have a balance of work hours you can go over, and that's really to protect you from not getting abused and working way too long and then being exhausted and then being harmed while driving home. But in the same token, if you were on a shift and now you're done and you're not really pressed to do something, and there's a really good case that's going to happen and it's going to go a little bit beyond what your hours are, if you can stay and watch it and be part of it, and if there's no one else scrubbing and you're the one's going to be doing it, stay. Do it. Do the case. It's not that every day it's going to happen, but take the opportunities if they make sense. If you're exhausted, you've been up all night, you're in a program with heavy call all night, and the next day you're entitled to go home and you can't physically stay awake, then go home and get some rest. Like be intelligent about it, but don't miss out on opportunities just because the rules say you can. If you can do something and be a part of something that will benefit you, even if it's not even your service. Let's say plastics has an awesome flap they're doing, or ortho has a case they're doing, or someone in the trauma world has a case and there's no one there to help them, and you happen to be there available, and it's not going to impinge you to stay a little bit longer. It's not going to make you, do it. Take the opportunity, use the opportunities you have, but don't swing so much on one side of the pendulum because the rules say you don't have to be there, so I'm not going to be there. And on the same token for us, we're not going to any longer, keep people to ridiculous hours and make them do ridiculous things way over what they're supposed to do. So just try to keep that middle ground. I broke that rule on occasion for sure, because there was no way I was missing a case. This case was it. There was no one else there to do it. It's a freebie for me. I mean, I just scrub and do the case for the attending, and he's psyched because he's got help, and it's past my hours. But so what? I'm going to do it. So just be smart. Use your intelligence to figure out when it's appropriate to do so, and when you don't want to, get in trouble with your director because you're doing something that you shouldn't be doing. That makes sense or not?
Yeah, definitely. I saw another hand from Tuba. Do you want to get on and ask your question?
It kind of got answered in this question, but I guess I'll just because I mean it was a little bit of an overlap. I was just wondering, I know you guys talked about things that we should prepare, how we could prepare for externships and what we should be doing, but what are some things that you think we should completely avoid, and we in a way where you don't overstep, but you're also not just on the sidelines, you're eager to learn, but you don't want to overstep your position because you're still a student. So just things like that you can avoid, or you should avoid.
Avoid asking to leave early. That should be pretty self-explanatory. I would say avoid, and this is me personally. I don't know how Dr. Raja feels about this, but I can tell when a student's trying to one-up other students, and it's just it's not cool. Trying to overshadow the other students because you want to stand out and be the star. So again, just make a good judgment call. Pretty similar to what Dr. Raja was saying, is make a good judgment call on when you should be answering a question and when you should be more involved. You want to have similar to the last question, you want to have a good balance where you're not just always on the sideline, but you don't want to be overstepping the other students and just answering every single question that the attending is asking. I don't know. Nothing else is coming really to the top of my mind about what to avoid, Dr. Raja.
Yeah. Tuba, you ask a good question, and my only answer is that, you obviously have, I'm sure you have a great personality. You have the innate ability to know how to answer something, how not to act and say something arrogantly or rudely, I think that's just the basics of it all. Be there, be involved, be on time the best you can. If you can't do something, make sure you have a solid reason why you weren't there. Someone that is never there and always has excuses for everything, their uncle died 14 times during the rotation, my cat's sick, just make sure you're there and it stands out when you're telling the truth about why you can be there. Be punctual, be there as a participant, and just be cordial, be diplomatic and polite with the way you answer questions, the way you speak, and don't be no, that's not the way it is, or no, just don't come off that way, and I'm sure you'll be fine that way. Also, I guess don't overthink it too much. I mean, listen, guys, at the end of the day, inshallah, things will work out. Things always work out for people that have good intention, and whatever is meant to be is meant to be, and you can make the best of any opportunity. I've been through 2 residency programs, a fellowship. I'm constantly going back and diving into the pool because I just like to abuse myself that way. But anyway, no, the point is I'm always learning, and there's always things that come up. Like the latest has been peripheral nerve and orthoplastics for me. And it happened me being in an attending position for 10 plus years. I went back to do these things. So you're never out of it. Don't overthink it. Just be yourself, be what you know to be, and you'll be fine. You know, it's just like, you can't overthink it either.
I'd say that's the main thing. Just be yourself. It's so hard it's so actually easy for us to see when you're not yourself.
Yeah.
So just go there and be yourself, because you're there for a month.
Yeah.
So one final question here. What is the best way to keep in touch after you're done rotating somewhere? What's a natural way to do that without it being strange?
I would say come back and visit academics. You know, we have academics twice a week, basically. If you can take some time to come back, that would be ideal. It's not always ideal for the students because they're on other rotations and stuff like that, which is why my program does a twice a month nightly grand rounds. So it's easy to hop on Zoom or come to one of those, and stay in touch with the residents, I would say. If you're really interested and truly interested in a program, you make an effort to kind of stay in touch with them, you know, not overbearingly, but telling them that you had a good month, you really enjoyed being there, and you hope to be a resident there.
Do you offer a virtual option for your grand rounds?
We do. We have that once a month, and then we have it in person once a month also.
Yeah. So the virtual ones are easy. You can definitely stay on board with those if you needed to. I mean, when you leave a program, you could probably just link on to their virtual grand rounds. And yeah, I agree. The residents are a key part of it because they're the ones a lot of times we rely on for a majority of that decision. So knowing the residents that would be technically a year ahead of you are the ones you want to probably stay in touch with. And then, you know, you can always email the program director or other people. And I remember I used to receive thank you cards from people. That was nice, you know. But I would say, you know, emails, stuff like that. It's just however you want to do it. But the point is you're staying in touch with those people and you're doing it however you're doing it, and not pushing it to the point where you're insisting on getting the program. But yeah, you're staying in touch with them, and they obviously will be interested in you doing that. So, but nowadays you have this other dimension of the virtual journal clubs and ran rounds that are there, and I'm sure they'll know you're on because obviously there's a list of people on there, and so they'll see that you're interested, and you can always comment afterwards. Hey, I enjoyed the grand rounds yesterday. It was great. It was a good case. They'll know you were there, and it's part of your communication with them.
Sure. Great. Well, we'll wrap it up there then. If you all wanted to, no pressure, but feel free to include your email in there, Dr. Javed and Dr. Raja. If not, I mean, that's reasonable.
No, please do. That's fine.
Just send our email to everybody, or my email at least, if Dr. Raja.
Yeah, we'll do. I'll definitely include that there. And then for all the people who tuned in, thank you for visiting. And then this whole thing was recorded too, so it'll be up on our YouTube channel. And then if that's okay with Dr. Javed and Dr. Raja, of course. And then feel free to ask the Muslim Podiatry Network questions too. Send us an email if you guys have any questions about anything. There's someone always manning the email and Instagram too, so feel free to do that. We're always available. I just wanted to thank you guys again, Dr. Javed, Dr. Raja. Thanks so much for your time. I know we ran a little bit over.
No worries, man. This is great.
You all being willing to do this.
This is great, man. This is like a first, an all Muslim panel. This is awesome.
Yeah, we're hoping to grow. That's
yeah, inshallah, man. This is great. This is fantastic. This is what we should be doing. I love it, and you're always welcome to email me. I may not get back to you right away. I may not, but you can feel free to email me, and then we can share, a phone number. You can text me as well, and we can go from there. But like I said, sometimes I don't get back to you right away, unfortunately, because you know how it is. Sometimes you're just not able to get to something until a little bit later on. But inshallah, yeah, let's do this again. This is great. Maybe a different question here. Maybe I can be more of a participant next time and ask questions myself. But good job, man. I appreciate you guys doing this. Mashallah, this is great.
Thank you, man.
All right.
Really
Assalamu alaikum,
appreciate it.
everybody.
All right.
The
Assalamu alaikum.
first man, he was the first to do a Juma prayer at ACFS. And now he's alhamdulillah, he's just stacking up these first. You know?
No, it's not me. There's a whole team of us here. It's definitely not
Awesome.
I love it, man.
All
Bye,
right,
everybody.
guys. Take care. All right.
Have
Have a
a
good night.
Assalamu alaikum.
Assalamu alaikum.
All right.